Psychopath versus sociopath. How to tell the difference. Have you ever wondered what the difference between a psychopath and a sociopath is? Did you know that one of them is born and the other one is made? Although these two terms are often used interchangeably and overlap, each has its own clear lines of distinction that you should know. Which one is more dangerous? What kind of jobs are they most likely to have? Keep watching to learn how to spot the difference between a psychopath and a sociopath, and why it matters. The psychopath. According to Oxford Learner's Dictionary, a psychopath is a person who has a serious personality disorder in which they do not care about other people's feelings. They do not feel remorse after they have done something wrong, and they desire to be violent or cruel to others. Are psychopaths born or made? Psychopathy has been linked to genetic predispositions. In psychopathy, the amygdala, an area of the brain that controls how a person responds to potentially dangerous or scary situations, is thought to be dysfunctional. This is clearly seen when psychopaths watch murder and violent scenes, and instead of being uncomfortable and disturbed, they appear calm and might even laugh. Psychopaths have been found to have structural and functional changes in certain brain regions, such as the prefrontal cortex, temporal cortex, and paralimbic structures. This occasionally causes them to have odor-related concerns. Did you know that their capacity to distinguish between different odors decreases as their psychopathy score rises? How to spot psychopathy in children. Children who demonstrate unemotional behavior, a lack of empathy, guilt, and shallow emotions are more likely to grow up to be psychopaths. These children are more prone to participate in aggressive and antisocial behavior such as bullying. Michael, who was 6 years old, was playing when his 3-year-old sister took one of his Batman toys and then refused to return it. He didn't say anything at the moment, but then 3 days later, while he was alone with her for a moment, he demanded his revenge. He smacked her over the head with the tricycle. She was knocked out and bleeding from the head. This incident occurred because she stole his Batman toy. This is a typical example of how psychopaths hold a grudge and get revenge. Teenagers who show early signs of psychopathy, such as a lack of empathy, might be diagnosed with antisocial personality disorder. They are also less likely to develop lifelong relationships since they cannot find the joy in these types of bonds. Social relationships. Psychopaths are unable to establish true emotional connections with others. Instead, they form superficial bonds that they later use to their advantage. Despite the obvious harm they cause, psychopaths never regret their actions. They usually form symbiotic or parasitic relationships and can be almost compulsively ordered while maintaining the appearance of normalcy in their social interactions. It turns out that dopamine, a chemical that awakens our brain's reward centers, is overproduced and overvalued in the brains of psychopaths. But why do psychopaths enjoy manipulating others? Well, it's simply because their dopamine receptors go into overdrive, enhancing motivation and their desire to get their own way. Their life in crime. Psychopaths usually commit crimes in the least dangerous way possible. They plan their crimes systematically in order to avoid detection and always have a backup plan. The story about Michael that we mentioned earlier is a prime example. Psychopaths have no feelings or guilt for their actions and are prevalent among serial killers. Career paths. Professions such as cops, attorneys, and doctors tend to attract psychopaths according to a 2013 study by Oxford scholar Kevin Dutton. The chances are higher to meet a psychopath in these professions as they arrive in large numbers. However, CEO is the most notable occupation for a psychopath. They enjoy their jobs and work hard to gain others' respect and trust, but they're also really good at manipulating people. Short concentration span. One of the lesser known traits of a psychopath is a short attention span, which can develop in ways similar to ADD or ADHD symptoms. Psychopaths are constantly looking for more exciting things to do because they get easily bored with ordinary activities and people. They may also experience a sudden loss of interest and objectives, undertakings, or connections that had previously been highly important to them. This could also be usually linked to a history of making hurried decisions or abandoning initiatives before they are completed. Twisted minds. Because of the way their brains are organized, psychopaths regularly have abnormal thoughts, which can cause them to say or do things that are weird and off-putting in informal conversations. When they talk about strange things they like, say hurtful things about other people, or act like they don't care about others, they are giving us an unexpected glimpse into their twisted minds. Compulsive liars. Compulsive lying is a trait that many psychopaths exhibit. They may exaggerate the truth to forward their agenda and influence others to think, feel, or act in a certain way. The majority of people with normal emotions feel remorse or at least some level of concern when they lie. But lying is guiltless for psychopaths due to their lack of conscience. Deception is a recognized symptom of psychopathy, and it might emerge as someone pretending to have sorrow, empathy, and concern for others. Can psychopathy be treated? The most effective therapies for treating psychopathy involve the use of a variety of methods. Treatment plans must include a wide range of alternatives, such as psychotherapy, the development of behavioral skills, and the recognition of the important roles that family, school, friends, and the community play. Patients who do not respond to other interventions are usually the only ones who are prescribed drugs. Sociopath. As earlier mentioned, people frequently confuse psychopathy with sociopathy. So let us investigate this term in further depth. A sociopath, according to Oxford Learner's Dictionary, is a person who has a mental condition and acts aggressively or dangerously towards others. Are sociopaths born or made? The term sociopath is used to describe individuals whose antisocial behavior is caused by a brain injury or detrimental sociocultural factors, such as parental neglect, friends who commit crimes, or other upbringings and belief systems. These individuals are mainly products of their environment. They have a little conscience. Although empathy and guilt can exist in sociopaths, they typically lack the strength to overcome their impulsive and unpredictable behavior. However, their connections may occasionally feel normal, at least with those they are close to. Sociopaths are not all cold-hearted like psychopaths. They do have the ability to feel some regret and guilt, risk-taking, and aggression. Sociopaths often act impulsively and without considering the risks or consequences of their choices when committing crimes. Let's take, for example, when Jamie was 8 years old. She almost drowned in the ocean. When the lifeguard fished her out of the water and breathed life into her, her first reaction were gasps of laughter. Sociopaths are also known for their tendency to get quickly angry, which can occasionally lead to violent outbursts. Poor career life. In order to avoid drawing attention to themselves or dealing with coworkers, sociopaths tend to avoid jobs that require them to engage with others one-on-one for extended periods of time. As a result, they are not typically capable of keeping their job. Can sociopathy be treated? Even though medication, counseling, or a combination of the two can be used to treat sociopathy, it's important to keep in mind that many sociopaths reject treatment. The reason for this is that they don't believe anything can be done to change their behavior. Additionally, some medical professionals do not advise these treatments to completely cure sociopathy because the stronger medications may cause sociopathy to be treated by suppressing symptoms and returning to normalcy as soon as the prescription is stopped. As we have seen, there are significant differences between the two disorders in how they handle crime, how they are in their careers, and even what their social relationships are like. However, their behaviors can overlap, which is making it difficult to distinguish between the two. So what was your favorite piece of information from today's video? Have you had to deal with real psychopaths or sociopaths in your life? Feel free to share your experiences with us in the comments down below. And thanks for watching.